Now we're scanning the right iliac region by using convex probe. Here we see the distal ileum. The walls of ileum are mildly inflamed and prominent. Now we continue scanning to the right iliac region from distal ileum to locate the ileocecal junction or find out cecum. Here we see the gases as echogenic line in the gut. Here we see a hypoechoic area surrounded by echogenic tissues. Now rotated a probe at its axis. It is a lumen which contain fluid and debris. Now we will examine the peristalsis in this lumen. We see no peristalsis present. It is appendix which is inflamed. The periappendicular tissues are also inflamed and echogenic, but no fluid or collection present at periappendicular area. On compression, patient feeling pain at this area. Now we will measure the anterior-posterior diameter of appendix. The anterior-posterior diameter of appendix is 12.7 millimeter, and the normal size of appendix is up to 6 millimeter. Now how we will write report.